right, good morning, and thank you so much for keeping it Citizen Television. We do not take you waking up with us for granted. Thank you for keeping us company from when we started the show till now. As we shift gears, getting into the health segment every Wednesday, it's all about health and wellness. And today we know we are almost hitting the World Kidney Day, the second Thursday of every third month of the year. A time to create awareness about our overall kidney health with a special emphasis on early testing so that we can be able to detect the status of our kidney health for better treatment plans and also for better response. And you'll be hearing from my guest this particular morning on the crisis that we are discussing. And of course, I have somebody who has lived the experience and he's scheduled to be getting a kidney transplant soon. He'll be telling us a bit about his own story when it comes to kidney health and kidney complications. But allow me just to sink you deep into the depth of this particular crisis. Kidney disease remains a significant global health burden. According to WHO, actually, it reports that chronic kidney disease is responsible for nearly 1.2 million deaths worldwide, and this is annually. And of course, if you look at our status in Kenya, the Kenya Renal Association is reporting that the number of dialysis patients is increasing every year, meaning that this particular condition is getting worse by the day. But it's not all doom and gloom. There are things that we can be able to do to prevent and also to be able to manage in case you have been diagnosed with any form of kidney complication. And that's why we're having this conversation this morning. Allow me to introduce my panel that will be helping me unpack this particular issue. I'm having from my far right, Dr. Hussein Baga. He's a consultant physician and nephrologist. Karibu sana.
Thank you.
One of the issues we'll be talking about is the scarcity of such specialists in the country, making this burden a more bigger issue. And of course, we have Ronald Kasioka. Ronald is a kidney health advocate and an author. And I like that because you're coming from a very optimistic point, not somebody who is suffering from kidney complication, but somebody who is actually using your experience to advocate for better living. And of course, you told me you've written a book about it?
This is, I've written a book, Embracing Up, where I share my personal journey battling kidney disease for the last 6 years and also being on dialysis treatment to inspire and encourage other patients and also people going through difficult challenges to show them that it does not matter what you are going through, that you can still live your life, do your things. You just have to believe in God and keep pushing forward. All
right. There are many people who are watching you this morning, Kasioka, and they're asking, who is Kasioka? You're telling me you're actually in university.
Yes, I'm a student at the University of Nairobi. I'm doing a diploma in public relations, currently in my final year, conducting a research on the role of public relations in psychosocial support for children with chronic illnesses, focusing now on kidney disease, the condition that I'm going through. And also I'm a certified public speaker. I graduated last year through an organization by the name I Speak Society.
All right. Thank you so much for creating time to come and inspire, people out there, those who are not part of the statistics and those who are also already part of the statistics when it comes to kidney disease. Dr. Let's begin from just explaining the significance of, this day, the World Kidney Day. I mean, what is it that we should be looking at as our points of focus, and what are the key highlights for you as a specialist in this space?
Thank you. Yeah, so the World Kidney Day, as you rightfully mentioned, is celebrated every year in March on the second Thursday. And the main purpose is to create awareness about kidney disease. Unfortunately, kidney disease is quite rampant. As we have mentioned, it is one of the 10th leading causes of death worldwide. It is projected to be the 5th leading cause of death by 2040 if we don't take care. And what we try to do is to create awareness about, one, what the functions of our kidneys are, how to keep our kidneys safe and healthy, what are the signs and symptoms of kidney disease, and how to prevent kidney disease. So every year we have a different theme. So this year's theme is basically, are your kidneys okay? Detect kidney disease and protect your kidneys. So it's very important to understand that until the later stages of chronic kidney disease, you may be asymptomatic, meaning that you don't get the symptoms. And this is what makes it more dangerous, because it's considered to be one of the silent killers like diabetes and high blood pressure. Yeah.
So by the time you start seeing or noticing something, then it has already progressed to an advanced state. That's why it's called the silent killer. Silent killer.
Yes.
No wonder, you know, the whole conversation revolves around testing and early detection, because this is actually where the solution lies. Yeah.
Exactly.
Just to tell us a bit about, you've talked about one of the objectives is to expand the functionality of the kidney. Here we try to be as basic as possible.
Definitely.
So let's talk about the functionality of the kidney, which is a very vital organ in our bodies. And then what happens in the event that we say that we're having a kidney complication or a kidney function failure? Yeah.
So normally we are all born with two kidneys, and the kidneys are located in the back. Yeah, they're not here as everybody thinks.
Yeah.
They're actually in the back. So the kidneys are quite important in our body, and one of the major functions is to remove excess water and waste, which is passed out in the form of urine. Now, apart from that, they're also important in terms of regulating your electrolytes, like your potassium, your sodium, your calcium, magnesium, which are very important that they remain within the normal ranges so that your body functions can also be normal as well. Then it also regulates your acid and base balance in the body. Now, we're not talking about the acid in the stomach. This is acid in the blood, which is very important, because if there's any imbalance, then your enzymes in the body don't work. A lot of functions in the body become abnormal as well. It also helps in regulating your blood. So it produces a hormone called erythropoietin, which increases your blood levels, which is why you find that as somebody progresses through the stages of chronic kidney disease, they tend to get more fatigued because their blood levels tend to go low. It also produces vitamin D, which is important for our bones and muscles as well. Again, you find that patients who have got advanced kidney disease get severe bone pains. They get tired very frequently as well. So in a nutshell, those are the important functions of the kidney. Yeah.
So in the event you have a complication, then all that functionality is affected.
Yes. Now, unfortunately, all of these become more apparent in the later stages. You see, up to stage 3B, you may be totally asymptomatic. So we have stage 1 to stage 5 of chronic kidney disease. You may be living with stage 2 or stage 3 chronic kidney disease, and you may be asymptomatic totally. Sometimes you even get patients who come in with stage 5. And it is a bit too late now to see whether what we can do to reverse or to slow down the progression. Yes.
And the longer you take, the more difficult it becomes to reverse it, and even more expensive it becomes for you to have a treatment plan. Just because you've mentioned kidney disease, out of just curiosity, is kidney disease the only complication that affects the kidney, or we have? Just take us through the different types of kidney complications.
So when you look at chronic kidney disease, it's basically what you're looking at is the function and structure of the kidneys that has become abnormal for a period of at least 3 months. Okay, we give it a time period so that we know whether it is going to be reversible or not. After 3 months, then it is called chronic, meaning that it has been there for a period of time which is more than 3 months. So kidney disease, or kidneys can be affected by various conditions. Most commonly is diabetes and high blood pressure. So worldwide, including in sub-Saharan Africa, including in Kenya as well, diabetes and high blood pressure is the most common cause of chronic kidney disease, followed by obesity. Now, we are seeing this obesity epidemic in Africa as well, unfortunately. We always used to think that it is a disease of the West. Family history of chronic kidney disease also is a very important risk factor for developing chronic kidney disease. So if I have a family member who has chronic kidney disease, possibly polycystic kidneys, then that puts me at a risk for developing chronic kidney disease as well. Then we have what are called glomerulonephritis, which is inflammation within the kidney. So that causes you to lose proteins. You can get nephrotic syndrome, as what Ronald mentioned. And this can sometimes progress to end-stage kidney disease as well. Then we have autoimmune conditions like systemic lupus, which is quite common nowadays. Even in Kenya, we're picking up a lot of patients, and it affects females more than males. During pregnancy as well, like, sometimes the female pregnant women can get, the pregnant ladies can get very high blood pressures, what we call preeclampsia. That can lead to acute kidney injury, and if it's not picked up on time, it can now progress to chronic kidney disease. So there are various factors that can basically lead to chronic kidney disease. Yeah.
All right. I'll come back to you so that you explain to me whether that affects the pregnant mother or the child, because sometimes a child is born and they have kidney complications, yes, and people think maybe it could be something that the mother did and all that, just to, yes, clear the air on those issues. But let me hear a bit about you, Kasioka. Just tell me a bit about your story with the kidney complication that you're having. Which one is it specifically? And you're telling me you're diagnosed in, was it 2013?
Yes.
Yes. So when did this story begin, and how did you end up there?
I was actually in primary school, and I was diagnosed with this condition, nephrotic syndrome. It started with, I would wake up in the mornings, my face would be swollen, my body would get swollen, my feet, and after I was taken out to the hospital, that's when I was diagnosed with the condition nephrotic syndrome, and I was put on treatment, though with the swelling and also affecting my body, as the doctors mentioned, getting tired much more easily. It became a challenge to balance between my health and also attending school. So I had to stay out of school in my class 8. The whole of that year, I was out of school, in and out of hospital, admitted severally in 1 year, until the end of the year. I was able to go back to school, and I sat for my KCP examination, and by God's grace, I was able to pass. I scored 325 marks, despite having missed the whole year. And after finishing my class 8, I was not able to continue with my studies still, because the condition was not yet still well managed. So I had to stay out of school for another whole year. And during that another year, I was admitted 2 times in that 1 year. And each time I would get admitted, the condition would get stabilized, and I would go back home. And after still some time, it would get to recur again. I get back to the hospital, and the conditions continued. And after 1 year, I was referred to this doctor at Aga Khan by the name Dr. Doris Kinuthia, who now, after doing a kidney biopsy is where now you're able to get a cell now from the kidneys or from any body organ, and it's tested. After the doctor did the kidney biopsy, she was able to come up with now a specific medical plan that now helped the condition now stabilize, and I was able to go back to school. I went back to school, Form 1, I was okay, Form 2 I was okay, Form 3 I was okay. As I continued on my medication, I have to take my medication on a daily basis so that the condition is managed.
All right. Let me take you back a bit. I want to understand what happens, when you're saying the condition worsened or it became worse, what exactly was happening in your system or in terms of the health complications you are facing. For people who do not know what kidney complications, are, or what it does to someone, as somebody who has experienced that, what does it do? Like, how was your life around that time? What were you able to do? What could you not do? How did you used to feel? Yeah.
Most of the days I would wake up, my face swollen, and also my feet would get swollen, because you find that when your kidneys are not functioning well, most of the fluids that you take get retained in the body, and that would cause my body to swell. And also I would get tired much more easily, and I was not able to participate in normal activities like playing in school, interacting with my age mates. So it became quite a challenge for me, because that meant that you have to stay in isolation, because you are not able to participate in the activities that most of your age mates and also your teammates are playing.
All right. I'll come back to you to just pick up on where you've, put a comma on. But 12 years, that's how long you have lived with this complication, yes, yeah? Dr. he mentioned a bit about some of the symptoms. I know we've not quite dug into depth on that. Maybe you can run us through, in as much as it takes long for you to start seeing any telltale signs, So what are the telltale signs in the event now you get to that point that, you're beginning to feel the things he used to feel or see the things he is seeing?
So most of the times, among the very first symptoms is increasing fatigue. Mm-hmm. Yeah, and this is where the problem is, because everybody feels fatigued, and you're like, oh yeah, I'm hustling a lot, I'm working 24/7, so
I need to rest.
I need to rest. So but people pat themselves on the back and say, yeah, I'm working very hard, that's why I'm tired. And that's a common mentality that we have seen, and all of us suffer from it, isn't it? If you're not tired, that means that you haven't worked hard enough, according to yourself.
Yeah.
So fatigue is is among the very first symptoms that you tend to get, because as the toxins build up in the body and as the stage progresses, your blood levels tend to go down. So that also helps, this thing informs the symptoms of fatigability. Now, as the stages progress and as more and more toxins get built up in the body and your urine output tends to go down, you find that your legs start getting swollen. And this is because of the water retention. Mm-hmm. You start getting a bit more breathless when you walk. So you can't walk a long distance because of breathlessness. Mm-hmm. Partly because of the low blood levels, but partly also because there's fluid filling in the lungs as well, as your urine output is going down. Then you find that you have loss of appetite as well, because the toxins also build up in the stomach as well. Mm-hmm. And you feel very nauseated. You might start itching a lot, especially if the toxins are being deposited under your skin. As time goes on, then you'll also get your urine output significantly reducing. Maybe if you're going 3 or 4 times in a day and your water intake is normal, you might end up going once in a day for a whole 24 hours. Mm-hmm. Yeah. But by that time, you know that a lot of damage has happened. Now, just to clarify for Ronald, he had what is called nephrotic syndrome, mm-hmm. which is basically whereby you're losing a lot of proteins in the urine. Mm-hmm. Now, there's another telltale sign as well. Mm-hmm. So when you are losing a lot of proteins, you'll find that your urine is very foamy, it's bubbly because of the proteins. Okay. Remember that the kidney is like a sieve. So it's not supposed to filter any proteins out or any blood out. So when that sieve gets damaged, and there are several causes for that as well, then it becomes leaky. So you get a lot of proteins leaking out. And when those proteins leak out, you'll start getting very foamy urine. And you start getting swelling of the legs very early on, and you start getting swelling of the face in the morning when you wake up. Now, at that point in time, if it's picked very early, we can basically salvage it and give medications. But even sometimes if it's picked early, it can still progress, unfortunately, depending on the severity of the disease.
Unfortunately, by the time these symptoms begin showing, it is already progressed.
Yes.
Yeah? But still there are interventions to that. I'll take you back to the causes. What is the space of unhealthy lifestyle in the causes of kidney disease?
So we have what are called the 8 golden rules of keeping your kidneys healthy.
Yeah.
Okay? So eating healthy and exercise are the first 2. Those are the most important things, and I can't emphasize that enough. You see, even if you go to any school right now, if a child doesn't have chips or chipo, he is not considered to be, in that category of the...
True.
Yes.
True.
So you'll find that your kids always tell you, what do you want for break or lunch? I want chips, those fast foods, I want crisps, those urban bites, I don't know what they're called nowadays, yeah. And this starts from childhood, unfortunately. And I will tell you about a study that I did in school students, later on. And as adults, because we have seen that this is the way to go, and we don't have a lot of time, because we're rushing, our lunch break is half an hour, 45 minutes. What's the fastest thing you can get and eat?
Fast food.
Fast food. That's why they're called fast foods, isn't it? Chipo and a soda, or a burger and a soda. So those are very dangerous and toxic to the body generally, okay? Because they'll have a lot of fats, the oils, the processed things in the burgers, those are very dangerous. And of course, you wash it down with the Coke, which is like sugar that you're just taking in, isn't it? Then we want to use transport, cars. We want to use lifts to wherever we want to go. So we are taking in a lot of calories, but we are not utilizing them. So what happens is that these calories then end up being converted to fat in our body. And fat initially we thought was benign. You'll see somebody with a big tummy and you're like, yeah, this guy is very affluent. And everybody thought fat was benign, but fat itself is quite dangerous because it causes inflammation within the body. And inflammation within the body is very bad because it damages all the organs, including the kidneys as well. When you become overweight or your weight increases significantly, then you are at a high risk of developing diabetes and high blood pressure.
Which actually are the risk factors
for kidney disease. So your obesity is a direct risk factor for kidney disease. Obesity causes diabetes and high blood pressure because even those two are related to obesity, which subsequently cause kidney disease as well. So you can see that by exercising every day, eating healthy, you're basically reducing your risk of obesity, reducing the risk of diabetes, reducing the risk of high blood pressure, and reducing the risk of kidney disease as well.
All right. So these diseases are cousins. I want to touch a hot potato, smoking and alcohol.
Oh, yes. So smoking is one of the worst habits you can ever take up. Unfortunately for the smokers and for those who market these things, this is one of the worst habits you can ever take up. Smoking damages all your blood vessels. Smoking damages your lungs, smoking damages your heart. Now, how does smoking affect the kidneys? When you have chronic kidney disease, because your blood vessels are being damaged by the smoke, and your heart is being damaged as well, when your heart gets damaged, remember it's the one perfusing all your organs, including the kidneys. So definitely your kidneys will get damaged. So the heart and the kidney are linked like this. There's something called the cardiorenal syndrome. When you have chronic kidney disease and you're smoking, studies have shown that it basically increases your risk of progression to end-stage kidney disease much faster. So among the things, eighth golden rule is stop smoking if you're smoking.
Stop it.
Yes.
Don't
just stop
reduce.
it. There's nothing about reducing. It is stop.
Okay. What about alcohol?
Same thing with alcohol as well. Alcohol, unfortunately, we used to say initially, oh, 1 glass of wine is good for
Not reduce, stop.
Because a study done 4 years ago, it was quite a huge study, showed that for up to 4 hours after taking even one drink, you're at a very high risk of developing abnormal rhythms of the heart. For 4 hours after taking even one drink. Alcohol damages the heart, it damages the liver, it damages the brain. It does, and the heart damages the kidney if it's damaged. A damaged liver damages the kidney as well. So you can imagine,
All right, doctor says if you're drinking, if you're smoking, stop, don't reduce. Hey, okay. So, Kasioka, tell me a bit about, let's get to the testing and now the stages of now managing, kidney disease. I want to understand from your story, everything that you have talked about in terms of symptoms and things that you used to feel. At what point were you diagnosed? Did it take long? Because one of the issues we are dealing with today as we raise awareness is the duration it takes before somebody actually knows that they have kidney disease. And so many people are walking out there with kidney disease without knowing. So for you, did you notice immediately or did your diagnosis take long? And then what was the next course of action after you were diagnosed?
For me, the symptoms were so much clear from the beginning. Though the diagnosis, the first time, the first hospital that I got to visit, the thing that I was being treated for, I could say it was a local hospital. So they really just gave me the medications just to manage the condition, but they did not have a much clear understanding of the condition itself or what I was going through. Until that time, I was now referred to that doctor. She was able to carry out a biopsy, and she had now a clear understanding of the condition, and she diagnosed me now with the nephrotic syndrome, and I was put on treatment. And from then on, the condition now, it was well managed. I was able even to go back to school. Things went back to normal. I could even get to participate even in games. I can say at that time, the condition really became really stabilized until that time now in 2019, when now the condition started to recur again. And after visiting now the hospital, I was now diagnosed with now the end stage now renal failure. It has now progressed now to stage 5, and I was put on dialysis treatment twice weekly. I still go for dialysis treatment 2 times a week. Like yesterday, I went for my dialysis treatment at Figo Care. It's in Parklands area, and I have to make sure that 2 times every week, I make sure that I go for dialysis treatment.
If you look at your circumstances, and now that you are an advocate, you're raising awareness, what would you say, what gave you an advantage And if you look at what other people are facing right now, what is it that you will see as challenges of people who have kidney disease are going through in terms of diagnosis, in terms of even access to the services that you yourself accessed, that you would wish that as we raise awareness today, these are the areas, as somebody who has worn the shoe, these are the things I'd like us to be focusing on as a nation?
For those years that I've been on dialysis now for the 6 years, having to interact with the patients, the adults and also the young patients, the children now on dialysis treatment, I've seen a lot of people lose hope. Let me use that word, lose hope, because you find that when someone is diagnosed with kidney disease and on dialysis, for most adults, if they are going to work, they tend to stop going to work. If it's for students, they tend even to leave school. Because I myself, I was even at that point at some time, I wanted to quit school, but with the support now from the family, my friends, and also the healthcare professionals, I was able to continue. One thing that I would say is the emotional support when it comes to offering the emotional support for the patients. And through one of our initiatives that we are running, another organization, RKF, the Kidney Foundation, where we are supporting now the dialysis patient by offering the emotional support and also creating awareness about kidney disease to educate them so that they understand what really they are going through, what dialysis treatment is, and also the changes that are happening to them.
All right. And also support from the schools and even support from the workplaces, because these people will need time, these people will need finances, these people will need that health break occasionally. So if there is no that understanding and that knowledge at the workplaces and at the schools, then you'd find, like the cases you're mentioning, many of them will just opt to drop out of school, not because they want, but because they don't have an option, or even just resign, not because they want, but because there is no option. That's the only way they can manage their condition. But then coming back to you, Daktari, let's talk about the testing of kidney disease. How is it done? What are the types? And talk to us about the concerns you have with the numbers of people who actually take that initiative to get tested for kidney disease.
Okay, that's an excellent question. And the tests are very simple. Yeah. One is a urine test, and one is a blood test. Those are the only two tests that you need, basically. And who should get tested? I mean, I find that that's a very important point that needs to be driven across to our people. So, of course, if you have symptoms like what Ronald did, you see, I mean, his is a case of nephrotic syndrome, which is a cause of chronic kidney disease. But remember what I mentioned earlier on, is that the most common is diabetes and high blood pressure. So if you are at risk of developing chronic kidney disease, so who is at risk of developing chronic kidney disease? Somebody who has diabetes, somebody who has high blood pressure, somebody who is obese or with increased weight, and somebody who has had a family history of chronic kidney disease, and even somebody who has had kidney injury, and even if it recovered fully, that person is still at a higher risk. So these are the people who should go for regular testing. Yes.
These are the high-risk populations.
These are the high-risk populations for chronic kidney disease. Yeah. So you have to, I mean, if you're diabetic, if you're hypertensive, please ask your doctors to test for kidney disease for you. A lot of times, because, you know, you find that after every 3 months you come to my clinic, I'll ask you the same questions. How are you feeling? You know, some basic questions that we have. I'll examine you and then I write for you the same medications. And you're like, but the doc is doing the same thing over and over again. Why should I waste my time sitting in his clinic, paying his consultation fee? So I'll just take it from the pharmacy. And that's a very wrong thing to do. There are reasons why we ask you those questions, and then every 6 months or every year, depending on what we find on our initial blood test, we ask for annual checkups or biannual tests that we do depending on the risk factors. Now, if you find that you have developed chronic kidney disease from these tests, it is not the end of the world. That is the most important thing. And you can see Ronald here. He took it upon himself to turn his life around, and this is impressive, trust me. When I first came back from South Africa in 2015, my first patient that I told her that she has got kidney failure was somebody who has been told that several times for the past 6 months, and she's been told to start dialysis. She broke down in my office. She told me she wants to write a will.
So that was a death sentence?
According to them, it was a death sentence, yes. And it's like a death sentence to very many people as well. We have patients who are living on dialysis for more than 30 years currently, and they're doing very well. Of course, we would prefer every patient who has got end-stage kidney disease or kidney failure to be transplanted if you are eligible for a kidney transplant, like what Ronald is working on. Okay? But sometimes because of various health conditions, you may not be eligible for a kidney transplant, but that doesn't mean that that's the end of life. Yes. So you have to, one, get yourself tested regularly if you're at a high risk. Two, you're also at high risk, and this is very important, if you're taking over-the-counter medications. And this is very, very important. You get a headache, you sprain yourself, you go to a pharmacy, the first thing they will do is to give you painkillers, like Brufen, diclofenac. They won't ask you about your history. Do you have any problems like diabetes, high blood pressure? Do you have any kidney problems? And once when somebody gets better, then it becomes like, yeah, this drug works for me, or this medication works for me. Anytime I get a headache or I'll get some sprain or joint pain, I'll just take it.
And they sell you what you ask for.
Thank you. And this is where our problem comes in. And the other issue is herbal medicines. This is another thing that I've seen that has come up quite a bit in Kenya and sub-Saharan Africa. Traditional healers and herbal medicine, those herbs have not been tested scientifically to know how they will react with your body. And I've had patients, a lot of patients who have come in with the use of herbal medicines to detoxify or to clean the gut, and they come in with kidney injury. Thankfully, some of them, we pick them up very early. Unfortunately, some of them come in with stage 4, so there's not much we can do. We can only put you on medications to slow down the progression to end-stage kidney disease. The other important test now, once when you are diagnosed with chronic kidney disease, is imaging or ultrasound. Sometimes we can pick up chronic kidney disease by an ultrasound. For example, if somebody has gone for an ultrasound for whatever other reason, and then the ultrasonographer picks up cysts in the kidney or growths in the kidney. So that is also classified as chronic kidney disease as well.
All right. So some medications can cause kidney complications.
Yes.
Yeah? All right. So over-the-counter purchasing of drugs and medicines, I mean, is not recommended.
It is not recommended at all.
All right. There's a question I was meant to ask you just before it slips my mind. The complications that come during pregnancy. There are so many mothers who maybe give birth to children who have kidney complications. And because of the myths and misconceptions, you hear people say it's something that the mother did or something, you know, just to explain to us how that also happens.
So when a child is born with kidney problem, that's called congenital disease. Yeah. And it is not because of what the mother did. Yeah, it is something that happened during the development of the fetus all the way to, I mean, from the embryo to a fetus all the way to a full-grown baby. And unfortunately, even at that point in time when the baby is born, you might not pick it up immediately. Like the most common is posterior urethral valves, which are basically some obstruction to the good flow of urine in the baby. Most commonly, it affects the males. Or you can get congenital abnormalities of the kidneys and the urinary tracts. I mean, like you can be born with one kidney, or you can be born with atresia of the ureters, like the ureters are not formed properly. Now, you have to, I mean, and hats off to our mothers, because they will always be on the watch out, and anything small, they'll always call up the doctors or the pediatricians for those that are available. As he mentioned, he went to a local hospital where it was not diagnosed until a few years down the line when he met the specialist. And that is where you mentioned earlier on that we do have a scarcity, and it is very true.
Of facilities, of experts.
Facilities, experts, labs as well. So labs are very important, isn't it? So we are talking about a simple blood test called kidney function test. He will tell you in his hometown or in his village how many facilities are able to do that simple test, which we take for granted in the cities. Yes.
Sure.
It is very scarce, unfortunately. And even if it is there, sometimes the machine is there, but the reagent is not there. Sometimes the reagent is there, the machine is broken down. Sometimes the lab personnel are not there to run the test. So you will have so many issues that we are facing as, challenges that we are facing as a country that we really need to look into to protect the health of our citizens.
All right, we'll talk about that before we wind up, just the health system and its status in managing kidney disease. But let me come back to you, Kasioka. Just run me through your treatment journey. You've been living with this condition for 12 years. That's more than a decade, yeah? I want to understand how your treatment plan has been, graduating from what to what, to now your next plan is to have a transplant done, yeah? Just talk to me about how that has happened over time and why you had to move from one to another and how it was for you, how it has worked for you. Dr. will talk about the treatment options after he has run us through his journey.
For my dialysis treatment, which I started in 2019 January, back then I just joined my Form 4, actually. So balancing between having to go for dialysis treatment 2 times a week and also attending classes was quite a challenge, because going for dialysis 2 times, it meant that for every week, 2 times of the week I'll be out of school, away, going for treatment.
Was it a boarding school or a day school?
First it was a boarding, but then I was not able to manage, because you find that as a dialysis patient, you are put on a special diet. That's the first thing. So when it comes to the diet that you are recommended by the nutritionist, it has to be prepared in a special way. And you find that for most of our high schools, it's not something that they can be able to provide. So I was able to transition. I went back to day school. The school was not far from our home, so I went to day school. I continued on with my studies for the Form 4 until now the end of the year, and I was able to sit for my exams. I fairly passed, and I was able to continue with my studies.
So dialysis 2 times a week?
Yes, 2 times a week. But immediately I finished my Form 4, I fell into depression because I realized that the whole year that I was in Form 4, the thing that was keeping me going was the support now from the family, the school, and also the hospital, the healthcare professionals. But immediately I finished my Form 4, I fell into one of the hardest time. I fell into depression for almost 2 years. And during that time, I isolated myself. I felt that I just wanted to stay in the house, just all alone, locked away the whole day. I only came out of the house going to the hospitals for the dialysis treatments. I even stopped going to church. I remember at that time, it was really quite a sad time for me. And during that time, I found that I started developing new passions. Like back in high school, I was a writer. I used to be one of the best creative writers when it comes to creative writing. But immediately now, that time I fell into depression. I found that I started perfecting my writing. And it was out of that time that I started writing and sharing my poems. I'm a poet. And the poems that I was writing at that time, it was out of pain and also the sad time that I was going through, because I had so many questions, like why did this had to happen to me at such a young age? Because yes, I had dreams that I had in mind that I wanted to achieve in my life. So during that time, the poems and also having to go through what I was going through, I at some point felt that people did not really understand what I was going through, because going through dialysis twice weekly, and also having to take my medications on a daily basis, because you have to take your medications on a daily basis. That was really hard for me.
At your age, did you experience like stigma? You know, your peers are doing things, they are living their life. You know, that's a very crucial stage for a young boy. So in that solitude, that's when you're saying you turned your pain and you're putting it all down on paper through poem.
Yes, yes. Yeah? I used to, like, can I use this word, envy the perfect lives that people had. Yes, yes. While I have to go for treatments every day, like sometimes even 3 times a week I'm in the hospital. So you find that the hospital is like my second home most of the times. And during that time, I started writing my book. I wanted to share my story so that people could really understand what I was going through, because I felt that they did not really get what was happening in my life. And the title that I had chosen for that book actually was not the title that I have now. I had chosen a title, The Outcast, because I thought that people really did not get to understand what I was going through, that I was just so alone or by myself. And during that time, when I wrote the book, The Outcast, and I tried approaching the publisher, actually got to sit down with me, and he asked me so many questions. One of the questions was, why did you choose the title?
Outcast.
And yes, and I even had time explaining to him, because for me, choosing that title, the one thing that I can say, I just wanted to prove people wrong, and also to seek their attention in such that to show people that despite that the challenge that I'm going through, and having not a perfect life and like a smooth life, I can still be able to do something that can be meaningful.
All right.
And over time, I was introduced to one of my friends, who is also my mentor. By a friend, we went now to the same high school. And when you got to sit down with him and he offered some guidance, it was out of those moments that now I got to have now the thoughts that came now of now coming up with a title that will really now speak of the main reason why I had written the book, the main purpose why I had written the book, now to inspire and encourage the people that are going through same condition, and also people that are going through difficult challenges, also to show them that they can still live a meaningful life, and they can still be hopeful in their lives.
All right, so you changed the title.
Yes,
from
the
Outcast
current
to?
title is Embracing Hope.
Wow, okay, that's quite a turnaround. But interesting and inspiring story you have going there. I'll talk to you about now what next for you as you wait for your transplant. But Dr. just quickly, because you're almost running out of time, treatment options that are out there. There's one, while I was preparing for this show, one of the biggest concerns I came across was patients who are staying long on dialysis without, any option, yet they would wish to do a transplant. There are factors that are there that hinder, many from doing that. Talk to us about the treatment options and what you, as experts, decide to go for one vis-a-vis the other, and just, what happens.
So when you reach kidney failure or end-stage kidney disease, there are only two options left. One is dialysis, and the other one is a kidney transplant. So, of course, because of the fact that we tend to see our patients a bit late, and there's an economic angle to transplants. Majority of our patients actually start on dialysis as a first option. Now, overall, there are two types of dialysis. One is called hemodialysis, which is whereby there's the blood purification. And in that case, like what Ronald goes through, is that we have an access, either a catheter, which is a pipe that is inside one of your blood vessels, or there's a fistula, which is your artery and vein are joined together. And we get blood from that running through a machine, which we call the surrogate kidney. So that machine basically does the same thing as what a kidney does. It cleans the blood. It removes excess water, toxins, regulates the electrolytes, regulates the acid base, and then that is returned back into the body. Peritoneal dialysis is whereby we use the peritoneum, which is a membrane within the abdominal cavity. So we put in a catheter, which is again a pipe, into that cavity. We put in a specialized type of fluid into that cavity. It stays there for 4 hours, and then it is removed. And you do that at least 4 times in a day, in 24 hours. So that is dialysis. Now, unfortunately, dialysis is not the mainstay of treatment, because you want everybody to be transplanted. A kidney transplant...
That's the ultimate goal.
Yes, that's the ultimate goal for everybody. And a kidney transplant basically brings you back to as normal as you can be with somebody who is not having chronic kidney disease. So you don't have to go to hospital twice or thrice a week for dialysis like you saw. You heard from Ronald, okay? You don't have pipes coming out of your body. You don't get frequent infections as well. Your quality of life improves significantly after a kidney transplant, and even the longevity of your life is much better, is much higher as compared to somebody who's on dialysis. So the general rule of the thumb is we would want everybody to be transplanted within 2 years of starting dialysis.
But how easy is that?
No, so this is where I'm going. Unfortunately, it is not very easy because there are two aspects to it. One is that we don't have what is called a disease donation program, whereby, for example, if somebody passes on and they have agreed that they want to become a kidney donor, then we can utilize their organs and give it to somebody who is on the transplant list. We are working with the government. I'm one of the task force members for the disease donation program. And hopefully we should be having something either by the end of the year or next year for the disease donation, because we need very stringent laws, frameworks. Everything has to be put in place to now proceed with the disease donation program. So currently we are having what is called the living kidney donation program. And again, because we don't have the laws and the regulatory frameworks, as a society, the Kenya Renal Association, we agree that we'll mainly do living related, so that there's no chance of exploitation. So now, the first aspect is getting a donor to agree to donate the kidney. It's a very difficult talk to have, and
there are social, religious issues.
A lot of issues
needs,
that people have to, yes. And then the other aspect is finances. So finance is another strong component to which deters a lot of people. You see, because if you look at it, the dialysis used to be covered by NHIF and now by SHA. The transplant cost is not fully covered. SHA reimburses a certain amount. The rest of it has to be by the recipient himself.
Is it 9,000 per session for the dialysis?
It is 10,500 now.
10,500.
Yes.
The last I checked, it was 9,000.
It was 9,500. But now, if you look at it, the dollar price went up, inflation has gone up significantly, and even this, after a lot of negotiation with the people who supply the dialysis machines to us and the consumables, we had to do a lot of advocacy. His groups did a lot of advocacy as well to make sure that the costs don't go up so much, because these costs were there for 9,500 for almost 8 years, when the dollar price was still fluctuating between 90 and 100. Then the dollar price went to 160. And remember, everything that we import it and pay in dollars. So that cost went up significantly, but at least we managed to request them not to hike up their prices too much, the suppliers, so at least that really helped us. So that is being covered by SHA. Now, when it comes to medications, the chronic medications, yes, SHA has promised that it's going to cover the transplant medications, the post-transplant medications. Because remember, even after a kidney transplant, you're supposed to be on medications for the rest of your life. Every month, you're supposed to take medications to prevent your body from kicking out or rejecting the kidney. Okay? Those medications are expensive. They cost around 40,000 per month in the first year, every month. Then the second year is going to be 30,000, and then the third year onwards is 25 to 30 as we reduce the dosages. Now imagine forking out 40,000 every month from your pocket.
That's
for anybody, it's a tall order. So whenever I would talk to my patients about transplant, they would ask me, but doc, I'm getting free dialysis. The medications are not free. I can scrounge up the money.
That's why they would rather stay on dialysis?
Despite, even if I tell them your mortality will be less, this will be less. So, it's a dilemma for us as healthcare professionals.
Well, I'll come back to you as we wind up, just to tell us, what recommendations you have for our health systems, what should be done to prevent Kenyans from, dying out of preventable, even manageable kidney disease. But let me finish up with you, Kasioka. Tell me about what's the next course of action. You're scheduled for a transplant. You've gotten a donor. How easy was that? And just tell me your expectations with what's coming up for you.
I'm in the process now of preparing for a kidney transplant. Actually, my dad is my donor, which I honor and respect him for that. We started the process recently, and I'm hoping in the next few months everything will go on smoothly. As doctor has mentioned, the kidney transplant is quite costly in our country, and also when it comes to medication, which has prevented many patients from undergoing the kidney transplant process. And for me, the kidney transplant when it comes to now the covering for the kidney transplant, I've received support from one of our willing organization now to support for my kidney transplant and also my medication. And one thing that I would urge the government and also for the people that are responsible for that is if that could be looked on when it comes to the medication, the monthly medications for
after the transplant.
Yes,
all right.
If that could be made quite much affordable for everyone who is also a patient.
All right, can be subsidized.
Yes,
yeah? Thank you for that. Dr. Ari, let's talk about your recommendations as we mark the World Kidney Day. What are your recommendations for the health systems in our country? There's a lot going on. The overwhelmed dialysis centers. There is no space. You will be scheduled for months waiting, skyrocketing cost of treatment. We've talked about that. Shortage of specialists giving them services. So what do you think we should do to fix this problem?
So, you see, it is a very difficult thing because to fund any health system in any government requires a lot of funds. And unfortunately, if you look at a dialysis patient, the dialysis patient has to go for dialysis a minimum of twice a week. What is recommended is actually thrice a week. So even the twice a week, we are kind of shortchanging.
Yeah.
What is recommended? And remember that these patients have to be on dialysis for the rest of their lives unless if they get transplanted. And as you rightfully mentioned, we have more and more patients joining dialysis because, as we mentioned, that actually in Kenya, 10% of our population have chronic kidney disease. So if you look at the census, we had 52 million or 51 million, out of which 510,000 people have chronic kidney disease. I mean, 5.1 million have chronic kidney disease. Out of which 10% of those, there's 510,000 have chronic kidney disease that requires some form of treatment, like medication, strong follow-ups, Then 25 to 30,000 people require dialysis. Now, currently, we have more than 8,000 people on dialysis. Now, if you do the math, monthly, you require millions of shillings or hundreds of millions to be poured into the hospitals for them or the dialysis centers for them to provide that service. So we need to look at a model that is going to be agreeable for both the government, because the government has to pay for it, and also for the patients not to suffer as well. And that is the most important thing. I mean, I can't allow my patients not to do dialysis. But at the same time, I am constrained by the fact that if the unit doesn't get paid, I will not be able to pay. My suppliers will stop giving me the consumables, or my hospital will stop getting the consumables for dialysis, and it will shut down. So the government needs to understand that both the public and the private hospitals and public and private dialysis units are key to helping the dialysis patients. Number two, even when you're on dialysis, yes, dialysis is going to be funded by SHA, but they need to fund the medications that the patients require for dialysis. They require to be on the blood builders, the injections that they get at every dialysis session so that they can boost up their blood levels. If you ask Ronald the amount of catheters he must have had, because we keep on changing them, the fistulas that keep on failing, all of those need to be covered by SHA, because the cost of a fistula will be around 50,000 or 80,000 Kenyan shillings. So how many of us can afford that? It's very difficult. So sometimes I'll get somebody who will stop dialysis because they can't afford to get another access. And it's very risky. Then these patients are at a high risk of getting admitted because of infections. Now, again, when you ask my patients who are coming to my hospital, please do this test, they're like, is it covered by SHA? Okay, it's not covered, so we don't do it.
Thank you, Dr. Ari. Unfortunately, we've run out of time for this very important conversation. Let's just put a comma. Yeah? Hopefully in the near future, we should pick this conversation up as we end up. This is not a medical issue. It's actually a national emergency that the government needs to do something. We need a collective responsibility and better policies to be able to manage kidney disease in our country. So the theme this year, are your kidneys okay? And experts are really emphasizing on early detection. It will save you. It will help you to know the status of your kidney health, better interventions, whether you need to do some modifications in your lifestyle, and you could just save a life, and that life could be yours. So once again, are your kidneys okay? Find the answer to that question today, tomorrow, and this season that you're marking the World Kidney Day. That could actually go a long way. And spread this information to somebody who may not have been able to access it. My name is Safina Chengoma. Have a lovely day ahead, and thank you for watching this morning.